Cleft lip and cleft palate are among the most common birth defects in babies, and they happen when tissue and bone inside the mouth don't fuse properly. Oral surgeon Dr. Barry Steinberg with UF Health joins us this morning live via Zoom to show for National Cleft and Craniofacial Awareness Month. Good morning, Dr. Steinberg. Thank you so much for joining us.
Good morning, and thank you.
Are these factors that increase the likelihood of a child, or can you tell us about the factors that, can increase the likelihood of a child developing a cleft lip or palate?
Right. Unfortunately, you can't completely stop it. There are some things that can reduce the chances. Smoking is a known cause. Certain medications are a known cause. Diet is a known cause. But unfortunately, at the end of the day, we're going to still have to deal with cleft palate and cleft lip.
And what options do families have when it comes to treating the defects?
Well, really, over the past several decades, the use of a team and a team approach has really become the only way to go. So that the care is not necessarily centralized, but at least if you're going to a team, you're dealing with people who do this kind of procedures, take care of this kind of child on a routine basis. And we have that team in Jacksonville.
Oh, that's great to know. And does surgery have to happen during childhood? What time should they receive a surgery, and is it ever too late to receive a surgery?
Well, it's never too late, but there's time frames, and they vary depending upon center. But for example, if you talk about a child who's born with a cleft lip and palate, the lip is closed around 10 to 12 weeks of age, the palate at about a year, and then there are other surgeries that may or may not have to happen. Revision of the nose, which may be deformed secondarily, bone grafting the upper jaw, which can also happen, and that would occur at approximately 7, 8, or 9 years of age. And then anything else with scar revisions, for example, later on.
And how common is cleft lip or cleft palate?
So depending on where you look, I would say that the average is somewhere between 1 in 800 and 1,000, with it occurring more commonly in the Asian population, least commonly in the African American population, and Caucasians, whites falling somewhere in the middle.
And why is it so important to bring awareness to cleft and craniofacial, awareness, and make sure people know about this?
Yeah, I travel around the world taking care of children, and I can see how they suffer with the scorn of their peers and teachers. So taking care of a child here at the appropriate time will actually limit how that child suffers psychologically, how they suffer with their peers and in school.
And I'm sure you've spoken with a lot of families who were treated, had the surgeries to treat cleft palate or cleft lip. And what was that like seeing them after the fact?
Yeah, I get invited to more high school graduations per unit time than a lot of people. When a child comes for the care of a team, the team members become part of their family, and we watch them grow up. And there's nothing better than to watch them, quote unquote, graduate from the team, having completed most or all of their treatments.
All right, well, that is incredible. Thank you so much, Dr. Barry Steinberg, for joining us this morning.
My pleasure. Thank you.